Welcome to a very special week. I am here with Dr. Mark Filidei. Mark is the director of integrative and functional medicine at Amen Clinics. Mark is a physician. He went to UC Davis, then got his medical degree at the University of North Texas, did his internship at Tulane University and his residency in internal medicine at Brown. He was the former medical director of the Whitaker Wellness Clinic. Mark and I met, goodness, over a decade ago when I was teaching at the American Association of Anti-Aging Medicine, and we realized our practices were across the street from each other.
Right.
And Mark had a big interest in the medical aspects of psychiatric illness. And we decided we loved each other, and he's been here at Amen Clinics. How long now?
6 years, I think.
6 years.
Yeah.
And I refer probably half of my patients to him. And what we're going to talk about in this week in these 4 podcasts is the other reasons that can steal your mind. And, I started doing spec, goodness, almost 30 years ago. And I didn't learn one thing in my psychiatric residency that was going to prepare me for what really looked like a toxic brain. And when I first started, I was the director of a substance abuse treatment program. And so the awful brains I saw, I just assumed they were from self-harm. But then I would see these toxic looking brains of people who didn't drink and who were not using drugs.
No explanation.
And I had no explanation. And then all of a sudden, I remember this one woman, Carolyn, I loved her. She's like, I have brain fog. She had a terrible brain. She worked at a Christian university. There was no drugs, no alcohol. And it turned out she had mold in her house. And when her kids were in the house, they couldn't do their homework and she was yelling at them. And when they went to their friend's house, they could actually do their homework. And then I'm like, oh my goodness. So we're going to spend some time and talk about when you're not right. Well, what are some of the medical causes of that? Things like mold, Lyme, toxoplasmosis, other infections, mercury, arsenic,
It's a long
candida.
list. It's a long list. And I remember you telling your story, I think it was early on when you were doing SPECT, about that couple you were counseling. And they were really at each other's throat. You didn't even want to go see them. It was such a tough environment. But you found his brain looked terrible, and that he worked in a furniture factory. And he was inhaling these vapors, which were ruining his brain. So that's a story I always remember, where you just wouldn't know that without SPECT. So for me, I work up all the, quote, toxic brains that we see. And as Daniel was mentioning, it's a long list of possibilities. That's where the history is critical. So I'll ask patients all these really weird questions, like, do you have a water leak in your house? Or did anything start after foreign travel? Do you have a lot of fillings in your teeth? Do you eat a lot of tuna? You're not going to get that from a psychiatrist anywhere else. They're not thinking that way. They don't need to because they don't see the scans, right? So if we see a scan that doesn't look good, why? And that's where I come in and start my sleuthing. So people ask me kind of what kind of doctor are you? And I really think medical detective is the best description.
Yeah, it's almost like Mystery Diagnosis, the show, except we do it day in and day out with real patients. So often people who come here, they come here to Amen Clinics with anxiety, depression, ADD, addictions. And when we see that their brains clearly aren't healthy, it really begins to trigger for us the toxin or the infection. What got you interested in looking at this for mental health?
So it was interesting because before medical school, I actually did brain research at a UCSF affiliate with EEG. And so I've always been interested in the brain before med school. And then, you go to med school and things happen. And And I knew about the Ammon Clinic while I was at the Whitaker Clinic for years, but there was just no connection. So at the Whitaker Clinic, I treated everything else, diabetes, cancer, heart disease. We didn't do much brain stuff. In fact, when I saw psychiatric patients, I'm like, go somewhere else. That's not my thing. Until realizing how huge of an impact biology and these things have on mental health and the brain. I had no idea. And so connecting Ammon Clinic SPECT with what I'd been doing was unbelievable. And it's still, to this day, I'm learning new things all the time that are causing mental health issues. So
if somebody's brain's being assaulted by a toxin like mold or an infection like Lyme, what are the physical and emotional symptoms they tend to report to you?
Really depends on what the culprit is, but brain fog is a real big one. I just can't think straight anymore. I have brain fog all the time. My memory's going. And these, 30-year-olds. Fatigue, so physical symptoms as well that really have no explanation. So stomach-related issues. So it turns out yeast, candida, can cause brain fog and anxiety and insomnia. I lecture a lot on this, and I'll show all these psychiatric symptoms where you could be given 20 different drugs for each one of those things, and each one is caused by candida. So again, people aren't thinking that way. So multiple symptoms, physical and mental, brain fog being a real big one. Weird neurologic symptoms. I get weird pains. I get weird sensations. Could be mold. So it's kind of a long list, but the whole idea is to have some curiosity. As you always say, if you don't look, you're not going to find it. And the SPECT really helps that.
So on the scans, what we often see is when they're first being assaulted. So at the acute phase, there's actually a SPECT study on the Cunningham panel. So it's one of the panels we look at to see if there are antibodies. So what antibodies are, your white cells produce these compounds that go and attack foreign invaders. And sometimes they mistake your body as foreign tissue. And so that's why it's called an autoimmune disorder, where your white cells are attacking itself. And so it's just so interesting to think about, well, what could trigger your immune system to actually see you as the enemy, right? It's the ultimate, what I think of in friendly fire.
Yeah, it really is. And again, people are aware of autoimmune disease with, rheumatoid arthritis and things like that, but there's also the similar thing for the brain. And people aren't thinking about that much. Now, you can have an autoimmune encephalopathy where it's a severe hospitalized issue. There's a famous book called Brain on Fire, which was a reporter that had this similar thing going on out of the blue. Nobody could figure it out. It took a while. So that's the kind of thing that we're looking for here all the time.
Okay, so we'll see it on SPECT. And those of you listening, most of you will never get a scan. To suspect it if you have mental health issues, anxiety, depression, attention deficit, hyperactivity symptoms, insomnia, and the standard things you do for it don't work.
Right.
And so how do you begin to work someone up if, for example, I've sent you hundreds of people, and what are the things that would begin to give people a clue that toxins may be part of what's happening in their mind?
So that's a great question, and again, I ask this of every patient. One of the most important things for me is, when did things change? So if you were normal, whatever your normal was, and then you're not, what happened around that time? Did you go to school? Did you move into a new apartment? Did you have foreign travel? Something happened before. So we see plenty of folks that have ADHD from day one. Always been that way. They're just wired that way. That's one thing. If you were, quote, normal, whatever that happens to be, and then you're not, it's that transition I really focus on. And patients don't really think about that. When I take them back through their history, all of a sudden a light bulb goes off. Oh yeah, I do remember I did have XYZ happen around that time. So changes in your situation are critical for me to work it up. So
when did it start?
when did it start?
What was happening?
What were your surroundings? Where were
And
you?
I just thought another patient we share, she actually grew up right next door to a chemical plant. And they had a spill. And so other patient, I had this fascinating patient. He was 7. He tested with an IQ of 63. His brain looked awful. And he was from the San Joaquin Valley. And he grew up in a farm where there was lots of pesticides.
Yep.
So he was basically being poisoned,
Right.
if you will. So when did it start? Where did you grow up?
Your surroundings. So that can be key for the toxicity part. And again, with SPECT, so one of the great things about SPECT is, when you come in, if you come in here with whatever your issue is, let's say you're 30 and you have bipolar, OCD, what have you. If your scan doesn't look healthy, there's a brain problem. And so that's where we can really delve into what's the cause instead of just saying, I have a mental health problem. You have a brain problem.
Yeah, no, in my new book, The End of Mental Illness, I so go after that.
Yeah.
And especially bipolar disorder. So many people are diagnosed with bipolar disorder where they don't really have the classic symptoms. They are irritable and moody, but they don't have the classic sort of manic, psychotic episodes and then cycle into normal or depressed. They're always struggling, but they end up with a diagnosis of bipolar. And I often find it's either head injuries or toxins or infections.
Or infections, right.
And so when we come back, we're going to begin to go through some of the most common causes, and we're going to start with mold. Stay with us. Welcome back. So we're talking with Dr. Mark Filidei, the director of integrative functional medicine here at Amen Clinics. He's taught me so much about how to work up a toxic brain. And mold was sort of the thing that started it off for me. That patient that I mentioned, Carolyn, and I'm like, her brain's being assaulted.
Yeah.
And not one lecture when I was a psychiatric resident or a child psychiatry fellow on mold and mental health.
Right.
And then about 13 years ago, Dave Asprey, so the really well-known CEO of Bulletproof Coffee, he got a SPECT scan, actually from a friend of mine in San Jose who I taught how to do SPECT, and his brain looked moth-eaten. And Dave was doing his MBA at the Wharton School, where President Trump got his MBA. But he said he couldn't think, that he had brain fog, he had anxiety, he had insomnia, he thought he had ADD, but his scan showed severe overall low activity. And then he discovered he had mold. And he actually went on to do a documentary called Moldy that you can watch online. I actually think it's free. moldy.com, I think, or you can Google it and find it. And I mean, just stunning. I have his brain 13 years later, and it's dramatically better. So what do you know about mold? And how often do you find it? And what are the symptoms? And then what do you do about it?
Right. So I actually do quite a few talks around the country on mold. I actually used Dave's intro to Moldy to show folks how it can really affect people dramatically. It's a pretty good movie. I ask every single patient that we see, have you ever lived in a place that's had a water leak, roof leak, plumbing problem? Be amazed how many people say yes. Or does your basement get wet, especially in the Midwest where you have basements? They get wet. They get moldy. Mold is really bad for your brain. It's very common. It's also in food. Of course, Dave has, bulletproof coffee is one of his main things. It's in coffee and other things too. So it can be ingested, but we're more concerned about what's in your house. So how do you know if you have mold? If you see a spot on your ceiling, you probably have mold behind it. This is not the stuff you see in the shower or the little mildew. That's not what we're talking about. It's usually hidden. It's behind the walls. It's in the ceiling. It's under the floor. Had many patients that have come through here. All, if not all, many of their problems are directly from mold exposure. So mold is everywhere. There's some bad ones, though. They're called toxic molds. They produce mycotoxins. Those are really bad for your brain. Anybody can have a reaction, like an allergy reaction, runny nose, watery eyes. Any mold can do that. The toxic molds are the ones we're more concerned about, the so-called black mold. It can cause very weird psychological symptoms, neurologic symptoms, fatigue. Brain fog is the most common thing I hear about. I just can't focus. I just can't think anymore. My memory is going. Not so much on the pain. That's more kind of a Lyme thing, but you certainly can get things with mold. So if you've had a water leak in your house, you may very well have a problem. I just had one of our patients who had a mold inspector come by. I suspected mold because they were testing positive. Mold inspector came by, did a very poor job, didn't find anything. I said, no, you really have it, I'm sure. They had another person come in, and it was scary. The room he was sleeping in, this is the husband who had multiple issues, OCD, anxiety. He had cancer a few years before. And mycotoxins are immunosuppressive. They will promote cancer. So it was all behind the walls, black mold, behind the walls, under the floor, in the ceiling. And he was living in this for years. That could obviously affect you in a very adverse way. So it can be stealth. You don't have to have a Katrina mold problem to have an issue. So for patients that specifically have exposure in the home, that know about it, it can be a problem. You can do home mold tests. So mold testing can be problematic. Again, I could talk for hours on this. I do. But you can test your home. You can test your body. So we do tests here that can, if not directly, but indirectly show us you have mold exposure.
So, when you brought up Katrina, I'm just thinking of places where there are floods,
Right.
where
Houston,
there are
hurricanes, or Florida.
and where you get really whole populations exposed
That's
to
right.
high levels of mold. I used to live in Hawaii, and
Very
mold
humid.
would actually
Right.
grow on your shoes.
That's right.
if
I
you
had
didn't,
patients say that. Yeah.
take care of it.
Right.
And when you live near the beach, there's often mold just grows faster.
Correct.
With the humidity. Do you remember my dad when he had mold in his
Right.
house?
Right.
Right. And he got depressed. And this is a
Yeah.
guy that doesn't get depressed. He gives depression.
Yeah.
He doesn't get
To certain people.
depressed. If people suspect it, it's like, wait a minute, I've had a flood. I have these water damage spots on my ceiling. Can they go to Home Depot and get a kit? And how
Not
is
those.
that?
Those aren't great. So if you want to do your own home testing, you can do something called an ERMI test, ERMI. That's actually kind of government-approved relative moldiness test. Can be helpful, much more specific than a Home Depot test. So you can order those online. It might be a couple $100, but it gives you an actual print of what's there specifically. You can also get a mold inspector, of course, if you're really worried about it. So you can do a home mold test to give you a basic idea. It can be tested.
And
surface
so-
testing as well. If
So
you see
getting
something,
rid of the
wipe
mold
it.
is critically important. How do people, once they have it in their body, get rid of it?
So very good question. So there's kind of two major schools of thought out there. One is just get rid of the toxins with binders, charcoal, clay, oral stuff. But you may actually be colonized by this. So the only time you ever hear about mold in medical school is when they talk about aspergillus. So it's called an aspergilloma, right? A fungal ball in the lung. Only time you ever hear about it. usually in AIDS patients, immunocompromised, cancer patients. But guess what? You can have a little bit of that in there, even if you're healthy. And you're kind of bringing your mold factory with you, continuing to get the mold out. So you need to do systemic treatment, sometimes medication, nasal sprays, what have you. So it needs to be determined where it is as to how you get rid of it.
And mold is fungus. So is there a connection between that and candida?
Yeah, so it's in the kingdom of fungi, so yeasts and molds, right? Some yeasts people love, right? It's in beer or wine. So, but you get the idea there that the yeast are turning grape juice into wine by creating alcohol. So those can do that in your stomach. Candida can turn the sugar you eat into alcohols, which is why a lot of people with candida have brain fog and insomnia and anxiety problems. It's not the same kind of alcohol. Kind of, but it's not the same kind of alcohol, not the good kind. So
it doesn't make you feel good. It just makes you feel loopy.
Really loopy, spacey. So one of the top things I see, biological causes of anxiety, insomnia, and sleep is candida.
All right. So when we come back, we are going to talk about candida, and then we're going to begin to talk about infections that can also be toxic for your brain. Stay with us. Welcome back. We're having a discussion about the things that steal your brain or assault your brain. I'm here with Dr. Mark Filidei, Director of Integrative Medicine for Amen Clinics. Mark does so many things. He helps work up toxic brains, helps make them healthy, balances hormones in the Bright Minds approach that I talked about in Memory Rescue and I talk about again in the End of Mental Illness. That's how you keep your brain healthy or rescue it if it's headed to the dark place. You have to prevent or treat the 11 major risk factors that steal your mind. And we're really talking about two of them. We're talking about the T in Bright Minds, which is toxins, and the I, which is immunity and infections. I guess candida would fit sort of in both places. That it's like an infection.
Right.
It is an infection and it produces toxins. We were just talking, I have to get this in my head, that they use yeast to make beer and wine. And if you have too much yeast in your gut, I mean, all of us have a little bit, but if it begins to overgrow because you're eating too much sugar, that because sugar feeds yeast, that you're actually in your own body creating something similar to alcohol, and that you get loopy, but without the benefits.
Without the fun part.
Without the fun part, that you just sort of feel a bit drunk, anxious, brain fog, insomnia.
Right. Yes, and also the yeast, almost like the Toxoplasma, the other brain snatcher, yeast want you to eat sugar. So you can get cravings because you have yeast. It's almost like taking over your brain and saying, feed me. So when you knock the yeast down, the sugar cravings can go down. That's why you want to starve it out. But another kind of scary thing that comes up with this is they've found fungal DNA in the brain of Alzheimer's patients and not in controls. It was 19 out of 19 had fungal DNA.
Wow.
So could be even more of an issue with memory. I still think the fungi issue is a lot more a problem than we think it is for many conditions.
So to diagnose it, so you can actually get antibodies against candida.
Yep, easy blood test, right?
Are there other ways people can diagnose it besides blood tests? How about stool tests?
Stool test and urine test. So there's an organic acid urine test that looks for fungal metabolites. A stool test will actually find the yeast and type it and tell you what to do to treat it. Very common, very common.
Oh my goodness. All right, so let's switch gears just a little bit and talk about infections. And I'm a psychiatrist. Why do I care? because they cause all sorts of problems.
Right.
That's why I should care. And one of my very favorite cases, and I've probably talked about Adriana a lot. She's 16, beautiful, smart, normal, goes to Yosemite and on vacation when she's 16 and her family's surrounded by 6 deer. And they think it's a magical moment. But 10 days later, she's hallucinating, she's aggressive, she's psychotic. They hospitalize her at Kaiser. And what do psychiatrists do? You have these symptoms, that equals your diagnosis of schizophrenia, and they start her on antipsychotic medications. Abilify didn't work.
Right.
Risperdal didn't work. Zyprexa didn't work. And then, 6 months later, she's like shell of herself. Right. And her mom heard about our work, brought her to our clinic in Northern California, and the doctor, her brain was on fire, and found out she had Lyme disease from a deer tick, and on an antibiotic. In California, which is actually very common. In on an antibiotic, she got her life back and graduated from Pepperdine, recently got a master's degree from a university in England. She's, employed at a high-level job. And every day...
Who knows where they would have been if they weren't caught, right? If you hadn't have found that.
Every day about 1 o'clock, her mother texts me, how can I pray for you today? No, it's just... And I actually got to meet her about 2 years ago when I did an event in Northern California, and both of us just cried like babies. Lyme has been... you've really thought a lot about that and treated a lot of people with this.
Right.
Talk about how did you get interested in this?
So in California, we don't really hear much about it, but certainly it's here. East Coast, it's a lot more common. So it was actually my first patient at the Amen Clinic was when I really started learning more about Lyme in California. There was a kid who was here getting at a drug recovery center, sober living house. And he was 21, and he had done every drug you could imagine in every way. He was injecting meth into his carotid arteries at an early age. So his whole high school and college days were gone. It all started because he started feeling lousy. He was 14, living in Santa Barbara, got no Lyme there, feeling lousy, couldn't think right, not doing well in school, complaining that he felt kind of achy. Doctor couldn't find anything, not surprising, because they didn't look. And he just started doing drugs to feel better. He was starting to do something just to get rid of the pain and get his brain working. So that led down the typical road, wrong people, drug culture, and he became an addict. And his mother is actually the one that looked up the symptoms, and she said, oh my God, that's my son. He's got everything on the list for Lyme. And that's when the light bulb went off to me. I probably had missed hundreds of cases in the past in my own practice. It just wasn't on my radar. So now it is, and ever since, it's been all over the place. So it's in every state, some certainly more than others, but it's in California. And the most common one here is called Borrelia Miyamotoi, which doesn't show up on a standard Lyme test. So you have to do a little more digging. And you don't have to have a tick bite, right? So this can come from any biting insect. Classically, it's a tick. Classic, you see a tick, you pull it off, you get the target lesion, you feel lousy. But it's a lot more subtle than that in many cases. So you can't go by that.
So what are the most common symptoms of Lyme? I mean, it's really been what we've been talking about. It's brain fog, it's anxiety, but also pain and trouble breathing. A
classic Lyme, like Lyme, Connecticut, which is a town in Connecticut, Lyme is pain and fatigue initially. However, there's different species. The one in Europe, Epstein-Barr, more psychiatric issues, more neurologic, psychiatric. So there's 30 different species. They all have a different little profile. So classically pain and fatigue, but it can really be anything. It's called the great imitator for a reason. It can imitate almost anything. In the DSM, almost anything in there could be from Lyme.
On the Diagnostic and Statistical Manual, psychiatrists make diagnoses, and there's not a mention of Lyme, although they always say rule out medical causes.
Right,
but
who's going to do
if
that?
It's not on your radar, and many infectious disease doctors they don't
believe
treat
it
Lyme.
exists. They don't believe it exists. It's outside of the classic presentation. So if you did not have a tick bite, you don't have the rash, you don't have Lyme.
Except neuro-Lyme is in all standard medical textbooks.
So neuroborreliosis is when it affects your brain. And it can be in your brain, literally. So, and that's just one, of the many bugs that we look for. So Epstein-Barr virus, notorious for causing chronic fatigue syndrome.
But a lot of people have it. Like
Almost
I have.
everyone has had it. That's right.
But I was reading in the Journal of Alzheimer's Disease that if you've been infected, Epstein-Barr, herpes, CMV, that when you go under stress, they can reactivate.
Exactly.
You talk about that a little bit?
Yeah, so these viruses, Epstein-Barr, herpes virus 6, CMV, these are all in the herpes virus family. Now, people always freak out, and I have to say, okay, that's not that herpes. It's the same family. So it's a whole family of viruses like Epstein-Barr. They're permanent.
Although 30% of people have that herpes, right?
Yeah, that's pretty common too.
Really
right, so that can get a little sticky.
Or cold sores is
Right.
herpes 1.
Correct.
And there's actually a connection between cold sores and Alzheimer's disease.
Right.
And you wonder, so a lot of us have had a lot of these infections. It's how do you keep them dormant?
How do you keep them locked away? That's the key. So they're there. They're always going to be there. They can always come out of the woodwork. And I'll like in my patients, I'll say it's locked away. Your immune system's handling it. It's locked away in a cage. What can unlock that? Stress, a car accident, a divorce, another infection. The immune system kind of just goes to sleep a little bit. The guards aren't there. The virus starts
So
acting
keeping
again.
your immune system healthy is
Critical.
so important. When we come back, we're going to talk about toxoplasmosis because I just find that so stinking interesting. And we've had a number of cases recently. And let's spend some time and talk about how to keep your immune system healthy so you can lock these infections up for good. Stay with us. Welcome back. We're talking about the things that steal your brain, toxins, infections, and I'm going to talk a little bit about toxoplasmosis. It's really interesting. It's actually a parasite. And when this parasite infects rats, so it infects many animals, but when it infects mice and rats, it actually turns them into cat-seeking missiles.
They lose their fear. Right?
Which is, so the toxoplasmosis, the parasite, releases an enzyme that boosts dopamine in the pleasure centers of the mouse's brain. So the rat gets hooked on cat urine. So rather than cat urine go away if you want to survive,
Of course, right.
it's like heroin for it. It's like, no, got to have more, and goes toward the cat rather than away from it. So the cat then eats the rat, and the toxo gets to have sex and reproduce because it only has sex and reproduces in cats.
Right.
And so it's the classic tale of eat, pray, love. So if a tiny parasite can control the host, can control the behavior of its host, how much control do we really have over our own behavior?
A little scary to think about.
It's scary.
Yeah.
Huh?
That's why I really call it the invasion of the brain snatchers, because that's the ultimate example. Yeah, so the cats are obviously normally afraid. Rats are afraid of cats. They don't want to go there. The toxoplasma takes over their brain, so the cats survive. But guess what? In humans, it affects us too. Now, we don't have anything for cats, but, well, some people might. But it turns out that it increases workplace accidents. It increases risky behavior. This is in humans. Increases workplace accidents, risky behavior, pleasure seeking. Kind of the same thing. You want more dopamine. Suicidality.
Increases suicidality.
So it does kind of take over your brain.
And if you never look, it's easy to call someone bipolar. It's easy to call them depressed. It's easy to call them a personality disorder. It's so much harder to go, why? But it's so much more fulfilling, right, for you and I.
Yeah, because we can fix it.
When we fix people, we're not fixing their mental health problem. We're fixing their brain problem.
Right, the problem that's causing their mental health problem.
The problem that's causing, yeah. It's the whole idea behind the end of mental illness. It's like these aren't mental, they're brain. And if you don't understand the difference, you lose because you'll start talking to them about their mother. Talk therapy, and they need antibiotic. When they needed an antibiotic. So how do people keep their immune system healthy so that can manage the assault that regularly comes our way?
Yeah, it's a great question, and probably the biggest problem we all face now in our society, because we're just bombarded by toxins. The more you know, the more you want to just run away to New Zealand and hide. But, we don't, and so you have to deal with it.
They just had that mass shooting in New Zealand.
Yeah,
so
right.
Maybe that's not
Maybe
going
not. Maybe Snow Island, Australia, Tasmania. So problem is we're super toxic right now with everything. Electronics, food, air. That is immunosuppressive. So I see a lot of Lyme patients, and a lot of them that haven't gotten better elsewhere because the roadway wasn't cleared. So it's like a plane for takeoff. You got to have the runway clear. If it's blocked by metals and mold and whatever, you're not going to get better.
So if you have high mercury, high arsenic, if you have candida.
Right, all the things that prevent you from being healthy are key. Your immune system has to win this battle. Whatever bug we're talking about. Antibiotics aren't going to do it. Herbs aren't going to do it. Your body has to do it and has to be able to do it. So it has to have a good diet. Critical. You eat junk, your immune system's not happy. It's not going to work well.
Sugar. So McDonald's in the middle of the night is not helping us.
Probably not the best. Sugar will immediately lower your immune response. They did a study, actually, with McDonald's French fries. Immediately vasoconstricted after you eat them.
Oh, you have to send me that study.
So yeah, it's pretty wild.
In the new book, I have a whole section. If I was an evil ruler,
what would you do?
What would I do? So
McDonald's for every day.
McDonald's every day.
Yeah.
Although one of the funny ones you'll like, if I was an evil ruler, I'd have Howard Schultz run for president because he's the world's #1 drug dealer, right? I mean, caffeine is the #1 drug around the world with Starbucks. And then I'd put the little Starbucks symbol on the White House.
Yeah, that's good. And not just coffee, but venti mocha, triple frappuccino,
right, it's
whatever.
Coffee, it's bad fat and sugar.
Yeah, lovely.
It's a bad combination.
So diet, absolutely critical, probably top of the pyramid. You got to eat well. Don't eat a lot of carbs. Organic is important. it's definitely better. So reducing your pesticide burden. I recommend everyone go to Environmental Working Group, EWG.org website. Lots of great information there, which pans to use or not to use, and personal care products can be really toxic.
Yeah, no, there's an app I like called Think Dirty, where you can scan all of your personal products and tell you on a scale of 1 to 10 how quickly they're killing you.
Yeah.
And when I first did that, I threw out half of my bathroom. Now, I've been focused on being healthy for a long time. I didn't even think about my bathroom.
Yeah.
And
no, it's interesting. One doc I just talked to, just kind of a quick story, but her whole specialty is infertility. And so she gets referred by other doctors, these patients that can't get pregnant. They've been to all the fertility places. All she does, she goes to their home, she'll charge them a certain amount of money, and she'll just throw stuff out. Everything has to be green. So it's diet, clean products. She has a 100% success rate so far in failures for people that could not get pregnant. So,
well, and around
quality of lifestyle.
here for Amen Clinics, we have more pregnant women. It's crazy how many babies we had delivered this year. But it's because when people get their brains healthy, their ovaries are more effective.
So toxins are really a big issue, and we got to eliminate those. So you need to be, a brain warrior. You need to be a life cleanliness warrior. Just be aware. You don't have to be a freak about it. You can be if you want, but you just want to be smart.
So boost your immune system through diet, through
detoxification. So sweating of any kind. Infrared sauna is
really
great,
helpful.
but turns out the infrared, not super important if it's near or far. Just sweat. You're going to get toxins out. Dr. Genuis, who actually did a study on this, he studied people, had them collect their sweat in an infrared sauna, regular sauna, exercising. Metals come out, toxins come out, no matter how you sweat.
So sweating is good.
Sweating is good. Exercise, of course, keep everything flowing. So lifestyle is really top of the heap when it comes to keeping everything.
So it's not an infection, take an antibiotic, and you're done.
Right.
That if you really want to help, you have to support and activate in a healthy way your immune system so that it can lock away these infections. Now, what is the place for antibiotics? Because, we always know your antibiotics can damage the microbiome.
Correct.
So what's your thought on that?
So, I'm a Lyme literate doctor, so I treat Lyme with antibiotics when needed. But you always have to be aware that it is going to affect the microbiome, maybe in an irreversible way. So you don't want to use it unless you don't really have to. They do have a place, but temporary. Always being careful to take them with antifungals, so you don't want to get a yeast infection. Probiotics to reduce any damage from that. So gut health is another really important one for just keeping your immune system healthy. So how do you have a healthy gut? Always keeps coming back, a good diet. Feed your gut with things that will make your microbiome happy. Probiotics, maybe, depends on what's going on. So we do lots of stool testing here at the clinic as well to see how the microbiome looks, keeping that healthy. 80% of your immune system is in your gut. So that's a priority too.
80%, 80% is in your gut. So keeping your gut healthy is really, it's job one.
Right.
Really?
Because if
you
think
happens through lifestyle and diet.
Critical. People think of what's the biggest barrier between you and the outside environment? You might think it's your skin, but that's not that much. It's about the size of an umbrella surface area. Your lungs are the size of a singles tennis court if you spread them all out. Your intestines, the whole tennis court and everything around it. It's a lot of surface area to police. So that's why 80% of our immune system is there. It's got a lot of big job to do.
A big job. Yeah. Well, thank you so much. What an interesting
Glad to help.
week. If you want to see Dr. Filidei, call the clinic. Go to amenclinics.com. We also have integrative and functional docs in our Bellevue, Washington clinic and in our Reston, Virginia clinic. Stay with us.
If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're interested in coming to Amen Clinics, use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com. For more information, give us a call at 855-978-1363.